So what is Ebola and what are the signs of Ebola?
So Ebola is a disease that's caused by a virus called the Ebola virus. And this virus is one that normally lives in bush animals like fruit bats, but it's a virus that can get transferred to other animals and also to people. When people eat food that is infected, like bush meat that is infected with the Ebola virus and is not cooked properly, the virus can transfer from animals into people. And when it gets into people, it causes very serious illness that can lead to death. Some of the signs of Ebola virus disease is fever, very high fevers, vomiting, sometimes vomiting blood, diarrhea, lots of diarrhea, sometimes diarrhea with blood in it, fatigue, people feel very, very tired, not able to move. Some people have trouble breathing. Some people have a rash, on their skin from that, but not always. And this disease can progress, the symptoms can progress very quickly, and in a lot of people, it will lead to death.
And how is, you talk about the signs of Ebola and you talk about how someone can get it, but how is the disease different from cholera or malaria?
So Ebola the symptoms of Ebola can be very similar to malaria, like the fever and the tiredness. Those are all very similar to what people get with malaria. Many other diseases that are in West Africa. The diarrhea and the vomiting can look like cholera. So in that way, it can be very similar. So it's hard to tell in the beginning whether someone actually has Ebola or whether they have something else like malaria or cholera or even typhoid or meningitis. The only way to know for sure is to get tested for Ebola. At the time when there's an Ebola outbreak, it's very important to be able to tell the difference between malaria and Ebola, or between typhoid and Ebola, or between cholera and Ebola. And the way to do that is to have anyone with symptoms that could be Ebola. So if you have fever, if you have diarrhea, if you have vomiting, if you have excessive tiredness and weakness, especially if you've been around somebody who's had Ebola, then it's very important to get tested so they can know whether this is Ebola or not.
And so who is at the highest risk of getting Ebola?
So the people who are most likely to catch Ebola are people who come in contact with somebody who already has Ebola symptoms. So if a person has symptoms of Ebola and another family member or friend is taking care of them, cleaning them, bathing them, that family member is at very high risk for catching Ebola, because Ebola is spread through the body fluids of the person that has the disease. So through their vomits, through their stool, through their saliva, even through their tears. That's how Ebola gets spread. So people taking care of Ebola patients are at high risk. So whether it's a family member or even in the hospital, the nurses and doctors taking care of Ebola patients, so they have to protect themselves so that they don't catch Ebola from the patient.
Okay. And Mr. Thomas, is there a cure or vaccine for that? For Ebola?
Unfortunately not. As of this time, there's not been any vaccine for Ebola, and there is no cure for Ebola. Okay. And just to add to what Dr. Suaray said, it is very infectious and it's very contagious, and it can be easily transferred from one patient to another, especially if you're taking care of that patient. Unfortunately, in Sierra Leone and in general West Africa, the kind of medical care we have, family members are part of the medical team. They actually take care of the patients. A nurse does, the medications and all that, but to bathe the patient, that's done by family members. So it's very hard to actually have the family members step back from that particular role. So it's making it very easy for this particular dangerous disease to spread very easily in that particular area of the world.